Good morning and welcome to the September 30th Public Health Media Briefing. We're going to have staff cover a couple things. Dr. K will cover a general overview of where we're at and go over mask mandate. You'll hear from Rachel Allen on the latest regarding vaccines, and then Liz Gomez has an update regarding testing. After the updates, as usual, we will open it up for questions from the media. Please raise your hand, I'll call on you. And as a reminder, this will be the only media availability for public health staff today. So if you have a question, I strongly suggest that you ask it here. With that, I will hand it over to Dr. K.
Thank you. Good morning, everyone, and thank you for joining us. So real quick with the numbers. We are at 149,285 cases of COVID-19 reported to Sacramento County. We're averaging anywhere between 250 to 300 cases on a daily basis. And the case rate is now recorded at 17.9 per 100,000. So we are continuing on the downward trend, and this is true not just for Sacramento, but for the state as a whole. With the deaths, we are averaging about 7 deaths reported daily, and the total count we have right now is 2,181. With the hospitalizations, we are at 279 cases in the hospital, including 76 in the intensive care unit. So the downward trend is continuing for both the cases and the hospitalizations. We have been receiving some questions about the masking mandate that we have in Sacramento County. There are a number of counties in the state that have a masking mandate for indoor activities, and this is stricter than the mandate that the state has. And so we've all been discussing when we will be ready to end that specific mandate. And I think where we have decided, especially because this is where we're at when the state opened up in June, is at 5 cases per 100,000. But of course, we will be monitoring other factors as well, such as hospitalizations. With that, I will turn it over to Rachel to provide an update on vaccinations.
Hi, good morning. So earlier this week, my team held our first joint COVID flu event, and we went to Cortland at Bates Elementary. It was a really successful event, beautiful day. Lots of people came out. We gave 130 doses of flu vaccine and 26 doses of COVID vaccine. 16 of those were actually first doses. So a variety of people attended, which is what we were really hoping. A lot of families came together. We saw older adults very excited and eager to get both their COVID booster, which was newly approved, as well as their yearly flu vaccine. We saw some families come out with youth that were 12 and over wanting to get that first COVID vaccine. And then just a lot of families that we normally see at flu events, which is, moms and dads and grandparents and young children coming in for flu. So the families and the communities seemed very grateful that we were able to bring both. And so we're looking forward to doing more of these events. Again, you can find that calendar on our website, which is sacvax.com. I did want to touch on Pfizer boosters. I think when we left last week, we were still waiting for that final approval from CDC in the state. So we do have that, and I'm not going to go into a lot of detail. The information is on the CDC website, but Pfizer boosters are approved for 65 and over, 18 and over with certain underlying medical conditions, 18 and over who work in certain high-risk settings, and 18 and over who live in certain high-risk settings, both work or live in those high-risk settings. And the recommendations vary from should, so a very strong recommendation for some, and other recommendations have the word may. So it's really a decision-making process based on risk factors. The guidance can be found on the CDC website. We are seeing increased appointments at our community clinics, which we were expecting. We are doing quite a number of boosters there, but they're not overwhelming. We're not overwhelmed at our clinics, and we're hearing the same from our partners right now. I think, again, this large network of providers is able to absorb what we're seeing so far. We do want to remind the public, please look at this booster guidance and discuss it with your provider if you need to. We want to encourage you, if you're in that population, to really look carefully and seek out that booster. There's a large network of COVID vaccine providers in Sacramento County, so that could include a primary care physician or a health-based system like Kaiser or UC Davis, as well as a lot of the clinic systems throughout the county. Retail pharmacies are another great place. And you can find links to community clinics and pharmacies on MyTurn website. So when you go through MyTurn, there's a lot of places there that you can sign up and make an appointment for your first, second dose, and your booster. Vaccine Finder is another website that I have not mentioned before, but another good place that you can look for a vaccine provider in your zip code. Our county website is also a good place to find links to providers and clinics. We are continuing our community-based pop-ups, still trying to primarily focus on reaching those that have not gotten their first and second doses. So we are asking people, please, if you're coming for a booster, to make an appointment in our clinic, but we are still taking walk-ups for first and second doses. And with that, I'll turn it over to Liz Gomez to give an update about testing.
Hi there. So community testing is still running strong. All of our testing sites, except for Natomas and Branch Center, and we do have 14 testing sites in our network for the community program, are currently offering antigen testing for the community. We are working closely with the state to assess antigen supply capacity, and we'll provide updates to the community should we be unable to continue antigen testing. But at this time, you can walk up to all the sites except for Natomas and Branch Center and get an antigen test. As you know, there is a national shortage of antigen tests that our county and others across the state are working through. All updates for the latest information on what types of testing is available at specific sites can be found on our website. Our numbers have continued to decline since mid-August at the community testing program. However, we anticipate an increase in desire to get testing in November and December in alignment with increases in travel and family gatherings.
That concludes the update from staff. I'll now open it up to questions from the media. Let's see, go ahead.
Hello, Lizzie. Sorry if you addressed this off the top. Could you just talk about the latest information you have on children with COVID cases? I think last week you said it accounted for about 20% of new cases. Is that still the case?
Yes, that is still the case. Most of them, fortunately, are mild. So we have not seen a huge increase in the hospitalizations.
Mike, go ahead.
Hi, this is Mike from the SAC-B. Similarly, relating to children, have there been any juvenile deaths from COVID, either from the Delta variant or earlier variants?
Jamie, do you want to take that one?
There have been less than 5 total pediatric deaths throughout the pandemic. And for our privacy procedures, that's about all I can say about that topic.
Lena, go ahead.
Hey there, good morning. My question, I'm just wondering, is there a certain threshold or is there a certain guideline that Sacramento County needs to meet in order to remove our mask mandate?
Yes, as I said at the beginning, because there are a number of counties, including Yolo County and several Bay Area counties that do have this mandate in place, we have been discussing that so that we can have a coordinated decisions. And I think where we're all landing is at about 5 per 100,000 cases, because especially for Sacramento County, that's where we were at when the state opened up.
Mike, go ahead again.
Just a quick follow-up on that one. It's 5 per 100,000. Is that in line with CDC recommendations?
When you look at the CDC guidance, that actually falls within the low transmission. So I think it does make sense to put it at that point.
I'm not seeing any additional questions. As I mentioned, this is the last opportunity today for media to get questions answered, be able to talk to the public health officer. So if you have a question, ask it now. Going once, going twice. With that, I will conclude the press briefing for today. I'll send out a recording of this to everyone this afternoon, and it'll be posted on our website. Thank you for joining us.